COVID-19 testing work, the background, partnership, and process, expectations, projections around COVID-19 testing in Tulsa County. Going forward, Dr. Stevens, you're recognized. Presentation. Dr. Stevens.
Thank you very much. Please excuse my computer illiteracy. I'm going to attempt to share my screen, and hopefully you see that.
No.
But the good news is that Sherry printed out copies of your presentation for us, so we can have a hard copy to look at.
Yay!
There you go. Got it.
Well done.
Yay. Okay, you'll have the handouts then as a reference. Commissioner, do I have 10 minutes or so just to give me a reference? Okay, thank you, sir. I wanted to take an opportunity and very much appreciate the commissioners for giving me the opportunity to talk a little bit about OSU's response to the COVID-19 pandemic that we're going through. There we go. Just to touch, the mission of Oklahoma State University is building on the land grant heritage that we have, and it promotes learning, advances knowledge, enriches lives, and stimulates economic development through teaching, research, extension, outreach, and creative activities. We, of course, at OSU Medicine, we fall underneath Oklahoma State University, and our mission here is to educate and train osteopathic physicians, research scientists, and other healthcare professionals with a focus on rural and underserved Oklahoma. Of course, that focus is there, but we have a very large presence in Tulsa County. And just to put a little bit to that, and I don't think that we do a good enough job of letting everyone know what we have just south of downtown across the river. But this slide's even a little bit outdated. Our education providers, we have over 1,400 medical and research professional students on campus now, which is quite an increase for us over the last 7 years. We have osteopathic medicine, master's, doctorate, and certificate programs. So we don't dip into the bachelor's level, but all 1,400 of those are in the graduate programs. You can see the bubbles on the left-hand side of the screen. Those are the areas that we have, and they're pretty diverse, from forensic sciences that we partner heavily with the crime lab here in Tulsa, to biomedical sciences. We have a physician's assistant program coming online next year, and you can see the rest around the side. We have a large residency program in Tulsa and across the state. We have 9 residency training sites, one of those being OSU Medical Center across the river from where I'm sitting, but over 340 residents across the state of Oklahoma. So those are individuals who've graduated medical school and are now in their 3 to 5 year program to come out and practice their specialty in medicine. Our healthcare delivery system below includes OSU Medical Center, but also 28 outpatient clinics across Tulsa County, and a telemedicine network as well. And I'll touch a little bit more on that telemedicine network later. Research enterprise at the bottom is a growing thing for us. We've always performed clinical research and biomedical research and public health research, but year over year for the last 5 to 7 years, we've had 25% increases in our research enterprise, which is not something that you typically see right now in higher education. So something that we're very proud of. A couple of things that I want to talk about on the next slide, just from our overall response, statewide leadership. I couldn't be prouder, and really I think I've got a biased opinion here, but proud of Dr. Shrum and the leadership that she's had with the state of Oklahoma on the governor's task force. Testing capacity, this is what has really made news now, and something that we're very proud of, and I'll touch on that more in a few minutes. But testing capacity, and let's not get hung up on the numbers here, but it was a huge increase when we were able to come online for testing for the state. But we came online with active testing on March 30th, and we now have 16,000 tests that we have on site and are performing on a daily basis for the state of Oklahoma and Tulsa County. Knowledge sharing, something that if you have not done, I would encourage you to do. We have echo platforms now running for COVID-19, but and I will touch on it a little bit later. But we have echo platforms for teleeducation now to help. That's one of our biggest. We have 700 people online around our echo to help teachers and school districts across Oklahoma with online learning. But each 3 times a week, we have COVID-19 echoes that are going out to healthcare providers to get the latest information out. It seems like if you know what you're doing this morning, you have it ready by this afternoon, there's new information out. And you could almost say that it's 5 minutes. Every 5 minutes, there's new information. The primary care capacity, that's a tough one for the state at this point. When we really went away from trying to do well visits for individuals, we wanted to make sure that we were still taking care of the general population. When this started really ramping up for us 3 weeks ago and really trying to stop people who were just needing med refills and well visits, we had 0 telemedicine visits. This week will be well over 1,200 visits just this week. And I think we're seeing that across the system. So it's something that we all should be proud of. It's something that, just like giving this presentation, I guess it's something that we're all going to have to get used to for a little while here. And I think it's going to change the way that healthcare is delivered, quite honestly. And I'm going to talk a little bit more on telemedicine in a few minutes about our statewide outreach as well. And then we're also going to touch a little bit on the hospital and the COVID response to the hospital. The next is just, a slide on leading in times of crisis. Again, some of the things that Dr. Shrum's leading the way on is the statewide testing, the helping with the PPE procurement, provider readiness, the model, surge planning, crisis care. A number of those things are things that she's having a big push and a leadership role within at the state. So let's jump into a little bit more into the testing. From mid-January to mid-March, the CDC was the only one releasing tests and only entity that was really releasing tests and could do tests. Let me back up. A lot of our tests were going to the CDC in Atlanta. The public health lab in Oklahoma came on board online, but there was problems with faulty reagents and a number of other problems that really started a nationwide shortage of tests that was problematic. And the materials. So then you jump to materials. In early March, the FDA started issuing what's called emergency use authorizations. And that allowed certified labs to develop diagnostic tests for COVID-19. And that really resulted in an avalanche of commercial and university laboratories now launching COVID-19. And when they did that, it caused a tremendous demand on the supply chain for testing kits and reagents. This was the toilet paper crush of the testing sites. I put a timeline up. And I got to show you guys this. I got this as a gift from one of my employees. They had to bring in toilet paper to me and now it's going to be a trophy in my office probably forever, because I think that we're all going to have a little bit of traumatic syndrome after this is all done, but that's going to be my trophy. This is the timeline that I put together just to kind of show where we started and where it ended up. President Hargis and President Shrum, when we got to this point, we have resources across OSU. let's get together and launch this. And OSU Medicine on March 20th, we reached out to help identify machinery and knowledge that across the system that we could use. And we identified the Oklahoma Animal Disease Diagnostic Lab in Stillwater. There's a couple things as we go through this, and you jump through to March 21st, March 22nd. Once we identified this platform and this knowledge, we went ahead and ordered 3 additional machines to go along with the 5 machines that we have there. I was asked by a reporter yesterday, how were you guys able to do this? And part of it's lucky, but part of it is we were designed to do this. We were designed at this lab and at OSU to take care of pandemics through the food chain. And these machines work, they're the same machines, whether they're human or animal machines. It doesn't matter to the machine. And we had the knowledge at OSU Medicine for CLIA certification of high throughput. So we were able to use one manufacturer. We had all the machines from one manufacturer, and we were able to order from the manufacturer who also had the reagents. So we were able to order and receive shipment on March 26th of 10,000 test kits and reagents. And along this time, we put in for and were granted our CLIA, and CLIA stands for Clinical Laboratory Improvement Amendment, which is the certification to the human testing. March 27th, we started our validation process. So validation is really just taking those machines and running known positives and negative samples through to make sure that you're doing the right thing. And we were happy to report on March 29th that we had 100% accuracy. And on March 30th, we started accepting samples. And I'm going to jump back to why that's important, but that's 10 days. I mean, it was an incredible move from a university standpoint, and something that I'll remember forever, maybe scarred from, but we'll remember forever, and something that we're proud of as a university and should be as a state as well. So how does it work? And I don't want to get into this too much. I'm a pharmacist, so you don't want me running the samples. I'm better at managing people that are smarter than I am, but the samples are collected. So it says by nose or throat. Usually it's done through the nose. And the provider calls OSU Diagnostic Lab to schedule a pickup. We have a courier system that goes across the state and pick up these samples. We're routinely bringing in 1,200 samples a day now from Tulsa County, the swab, drive-through swabs here, as well as across the state. So in addition to clinic systems and hospitals. So we've greatly expanded everyone's ability to get samples done. As you see there too, the courier stops by, picks it up. We have collection sites in Oklahoma City and Tulsa, and then those samples are delivered to our Stillwater lab by midnight. The next morning, get up and the sample's mixed with these reagents. And the reason that it's mixed with the reagent is to pull the RNA out of the COVID-19 if it's present, and then to duplicate that genetic material. And then in number 4, when it's ran through our PCR machine, those are amplified, so then you can see the virus on the slide. So what's the impact of this? Why does it matter that we have testing? I picked 3 ways here. There's probably a multitude of others, but it expanded the scope of testing criteria. So now we don't have to only test just the sickest of sick. We're now able to hear from the governor's comments and really freeing up those medical providers to catch, as we've all heard, 80% of people who have COVID-19 are asymptomatic. So let's get more testing through so we really understand. It increased testing locations across the state. I saw a graphic last night. There's been 40-something testing sites now across the state. And a big reason for that ability to do that has been OSU's testing capacity. and then quicker turnaround time for results. We're routinely at 24 hours. Our numbers probably really 24 to 48 hours. Standing up a lab in 10 days, we're going to have some ramp up issues, and we've dealt with those, but we are getting results much quicker than what we've heard of the 5 to 10 days when we have to send those outside of Oklahoma. The other point that's not on here that I thought about after I submitted the slides was the ability to do this testing has improved the modeling in the state of Oklahoma greatly. And it's something that we're hearing in the news quite a bit right now is the flattening of the curve and the number of negative tests that we're starting to get. Oklahoma's 46th in testing and all of those numbers, but we weren't getting the negatives back and we weren't getting the throughput. But now with OSU's help and quicker moves through the supply chain, we're now able to really get more out there. Two things to touch on: COVID-19 echo. I've discussed that. Very large numbers, and if anyone would like to do that, send me an email and I'll get you hooked up. Anyone can watch that. But telehealth solutions for the surge plan across the state, we are sending out on April 21st 54 of these mobile units that you see to the right, and they are going to expand hospitalist coverage and coverage in rural hospitals across Oklahoma to help with practitioner and keeping patients local. Last slide that I have is, Governor Stitt several weeks ago mentioned COVID designated hospitals. We have been working towards, there's nothing that out there yet that we are a designated hospital, but we took that as a sign to be ready. We are ready at OSU Medical Center should we be called upon to be a COVID designated hospital. And rest assured that the city, the county, and Northeast Oklahoma will be well served by OSU Medical Center. I want to close with two things, just to thank the commissioners for the letter that was provided and the continued support that you've had for our VA hospital in Tulsa. That program is on track. That will add a new VA hospital downtown in the Kerr Edmondson building, along with the state psychiatry hospital on the grounds, as well as a new parking garage. And I'm happy to say that is on course with what we're doing. And three big projects. I don't think that it would be good not to be thinking forward in a situation like this. I know we're all trying to catch up, but around our psychiatry and opioid endeavors that we have here, we're going to extend biomedical research in psychiatry. This OSU telemedicine, it is really going to be a state asset. Going out to all those rural hospitals will take more of a forefront. And then if we become a COVID hospital, I think it's really going to push OSU Medical Center to the forefront. And it's something that we now need to think about. What assets do we have to be a disaster prepared community? And that state hospital in Tulsa is something that we all need to look forward at as truly a disaster response with the assets we have there. And I'll stop. I know I went over, but I always talk too much and apologize now. But thank you guys for your time and take any questions.
I think Commissioner Pete has a question. I have a couple left she was through.
So, Dr. Stevens, on these testing, are most of those coming through the health department being referred to come over, or how are you getting folks to be tested at the OSU site, and how many a day on average are you doing here at Tulsa?
So we do not, and I might have misunderstood your question. At the OSU site in Stillwater, we don't do any testing. We run the test.
Tulsa.
You know what, Commissioner, I don't have the actual number that are coming out of the Tulsa Health Department. Bruce can help me with that. But I can tell you that of the 1,200 tests that we took in yesterday up until midnight last night, about 900 of those were from county health departments across the state. And I think it's a fairly large number that are coming from Tulsa and Oklahoma City, probably in the neighborhood of a couple hundred at each site. And then you see some disbursement across the state. That's as close as I can get to your question.
Okay, yep, that gives me, yep, some idea.
So Dr. Stevens, if constituents call us, want to know where they can go get tested, we need to send them to their PCP.
We do, but with the expansion and it's still to go to their primary care provider, but there are some county health departments now that are opening up that you don't need a primary care provider to be able to open that up to. I got a text just a minute ago, and I don't want to start a rumor mill because I have not looked into this. It was literally right before you guys brought me on, but there's something out there now that pharmacists might be able to order tests. They won't be the ones that do the tests, but if you go into a pharmacy, they might be able to send you to a location to be able to do it. So we're seeing more of those expansion of scope, at least through this pandemic, that will be able to help. I need to check with Dr. Dart on exactly how much more open these swab pods are in Tulsa at this point.
So the last question is, so if someone gets tested today, they're good, doesn't mean they'll be good tomorrow, is that correct?
Right. I mean, that is the unfortunate thing. If you start developing symptoms or come in contact, you probably should be retested. Now, just to add to that, you're going to hear there are some antibody tests that are going on right now in the state. I know one in Tulsa in particular. I don't think that that's validated at this point, but in the very near future, there will be antibody testing that will be validated. And there's some Tulsa or some Oklahoma companies that are working hard on that and becoming validated. So once we have antibody testing, that's going to be helpful. So we will know who's already had it. When we were still ramping up testing, there was probably a fair number of people who already had it, and we'll be able to tell that. That'll tell us a lot about returning to work and a number of other things that are out there.
Dr. Stevens, so these tests that you're doing through OSU, are those all free? Or are you getting reimbursed? How does that work?
So we signed a contract. If for those people who want to utilize OSU lab, we don't bill the people sending in. We set up a contract with the state health department for them to fund the expenditures that we have into those tests.
Yeah, because I've heard some of these private sector groups charging $250 a test, which is
right.
onerous.
If people go through the swab, the county or wherever those swab pods are, they're not going to receive a bill on those.
Great.
Steve, thank you. Appreciate your time. We do not have technology. Can you take your presentation off the screen just in case we come out?
Yeah, absolutely.
Thank you so much. We're excited about the continuing work on the new facilities coming in.
Thank you for your time. I very much appreciate it.
Thank you. Moving ahead to action item 4B, Parks Department update. Vince Trinidad.
Hi, good morning, everybody. Hope you can hear me.
You too.
Okay, excellent. So I'm going to do a quick rundown of an oral report on exactly the timeline, what we started with our Parks Department. So started on the 18th of March. We closed our recreation centers to the public based upon the direction of FEMA and the Health Department on limiting the mass gatherings of 10 or more. A lot of this fall along the lines of the gatherings going from 250 to 50 to 10. At that time, it affected Chandler Park Community Center and Big City Community Center in South County. We went ahead and closed our spring break camps during that week. And any events that were larger than 10. At that time, we also started not taking shelter reservations until after the 9th of May. On the 20th of March, we closed our parks office to the public. We have such individuals such as myself and limited staff, only, but all possible. On the 23rd, we changed our staffing models for all our park systems. What we started doing was rotating our staff to maximize the recommended social distancing as the CDC guidelines. So we had some people on, some people off, but we still need to go ahead and maintain the golf courses and parks. So we do have staff that are kind of working on that. A lot of that's based upon the number of trucks we have or vehicles. We went down to one person per vehicle, so we're trying to use our resources to the best of our ability. So now our parks offices are closed completely on Fridays. Started that on the 27th, but we still have certain people that are still working. And then,
We're going to, so we have a full maintenance crew out there, or just part of a crew, or?
so we don't have at one time, we do not have a full maintenance crew out. We have a limited crew that's being rotated in and out with a minimum number of individuals that are out.
On the flood issues,
Come on.
on the flood issues we talked about quite a while back, is there anything you can do now that you can't do when the courses are open to address those issues?
So what they're doing right now is like they're punching the greens, so they're taking care of some stuff. They're really at the golf courses just really doing some of the stuff they normally would have done later on in the season, but they're doing them now with the resources we have available, so that when the golf courses do open back up, they're going to be ready to go ahead. They're being maintained meticulously each day.
Understanding Tulsa does not keep their maintenance crews on board. You know, have you heard that or not?
I read an article in Oklahoma Golf that I guess the city golf courses are doing something different than what we are. What that is, I'm not 100% sure. I know that we're out there continuously maintaining our fairways and our tee boxes. And if I was told by South Lake Superintendent, if we wanted to open up tomorrow, we'd be able to go out there and play.
That's great, Vince.
Yeah, I'm sorry,
So we also closed our Case Tennis Center at the end of another day on the 29th, and we closed South Lakes at the end of 30th. A lot of this is just for for our information, so exactly when things escalated with the number of individuals and the declarations from the municipalities on when we went ahead and decided to go ahead and close some of our stuff. We had at that point we also closed our grills simply because there's just no walk-up traffic that's happening. I had previously published to the commissioners the items that we had done for our golf courses when they were open, our tennis centers, maintaining the strict disciplines and guidelines open. A lot of those were best practices that are continually happening for those courses that are open within the metro area. Currently, right now, with our staff rotating and maximize those social distances, we're continuing to do the lower level at Chandler on the renovations. We're working with Hal Van Kuren to go ahead and continue that particular project. That's the vision. Also, funded project of about $1 million. If you go out there and want to take a look at it, you can see that we're starting to clear out a lot of the area down there. We're also working with county engineering and highways to go ahead and help us with some of the manpower and the equipment to go ahead and move some of the dirt in the areas. Our Bryan Park Community Center is almost near completion. The tile is down. Basketball court is in. So we'll look at trying to figure out when it's an appropriate time to go ahead and reopen that community center when the time is allowed. Hickey Creek, they're getting some new horseshoe pits. And at our grills, our golf course grills, our partner with Group Serve has applied to be a part of the Tulsa United restaurant program. So we're trying to see if exactly what we can do to go ahead and use our restaurant grill areas, potentially make meals for those that are in need during the pandemic. We're going to continue to work. You have a question? Sorry.
You're not doing takeout at your grills.
They had takeout, but they're closed now, Commissioner.
Yeah, so.
Yeah.
How's
So,
morale?
sorry.
How's morale?
You know what? The overall, I think that there's concern. Obviously, we're trying to do our best to go ahead and provide the facts versus the rumors. I know that I have been out to the staffing individuals and talked with different groups. They have great questions. They're obviously concerned. But one of the things that is nice about being part of the Parks Department, working in Tulsa County, we continue doing with our jobs, essential workers. They're grateful, they're thankful for that, and they understand that we're all going to get through this together. So I think that's the most important thing out there.
As you know, Terry's going to give a presentation a little bit on the Terry's relief bill we have to cover some expenses due to all this. So I hope you have a very elaborate program in place to track all your costs we would have had without this virus.
I'm sorry, Commissioner?
So do you have a good, very good program in place to track the costs you're incurring due to the virus outbreak? Because Fed's going to reimburse us for all the costs that you would not have had otherwise.
And lost revenue.
We do.
No lost revenue?
Next packet.
Okay.
Yeah, we have been tracking, everything that's been coming through. We have working with our grills, we were working with, on a per cap per golfer, so to say, that we would have made with the general sales through our food and beverage outlets. Our tennis center has very similar stuff as well as the golf courses. We're using projections and data based upon what we have done historically on what we would have had during the months, tracking that meticulously. We're also tracking everything that goes out, particularly dealing with equipment or PPE we need for our staff that are still out. When we're tracking everything meticulously, it's on a daily basis that we're making sure that we track everything.
Got another question. Okay.
Mr. Keith?
And then, so I know you were looking at doing, some of your staff maybe volunteering to do Meals on Wheels. Did that work out?
You know what? I think that right now, what we're going to do is this was based upon a conversation I had with Kathy Burrows with HR. If they're scheduled off and that they want to volunteer their time for doing so, then they're more than welcome to. Right now, we're gathering information that we can go ahead and provide volunteer options for them while they're not necessarily working during their normal shifts. So I think that's probably the best thing to do is to encourage them to volunteer in any of those sections that they feel that they would want to volunteer at. Some of them are staying home because they want to be there with their families, or they may have not felt so well. And most of our work staff, for the most part, about 80–85% are still healthy, and they're still out there daily working on rotating shifts.
So I know that, I think Sherry suspended the community service workers. And I don't know if anybody again would like to go chip in by Juvenile Week. They continue to have issues with trash. What? Out front. But anyway, that's another thing that would be a county, a big help for the county. I kind of drive by there every day. I think staff and juveniles having to go out. That's a pretty mess.
I would say that there's any particular things that county, our parks individuals can potentially go ahead and do, forward those to me, and I'm happy to go ahead and get with my team and see how best we might do it.
Okay. Thank you for everything you're doing.
I appreciate that. And I would say in closing, I am in constant contact with city parks on America and river parks, Matt Meyer. Go ahead and look at the best practices on what's happening during the pandemic. So we can go ahead and follow guidelines. We're keeping a close eye on our parks to make sure that we're doing everything we can. If things are closed, that they stay closed. But I can tell you that the observations I've had primarily at Acre and La Fortune, they're pretty sparsely populated. I know that La Fortune gets used on the jogging track. You may drive by and see a bunch of cars, but they're not congregating in one particular area. They're using the jogging trail. They're getting around. You may have what looks like a household walking through the park, so to say. I guess one of the good things is I'm starting to see a lot more hand-holding by people out there on La Fortune. So I guess that's a nice thing that's happened.
Thanks, Vince. Stay safe.
I appreciate it. Thank you, Commissioners.
Okay, 4C, let's do legislative update. Simon.
So, the legislature has been gone since spring break. And all they've really worked on is COVID-19 issues and health issues and things like that. Well, apparently last night that changed. This morning I get this packet of 28 bills. And I guess because the legislature figured out, at least on the House side, they can kind of work without them all being together. So now what they're going to do is any Senate bills, we have 7 of them in the House, they're now going to skip the committee process. And they've all been assigned to the floor for votes. So whether they vote by proxy or waves or tallies or whatever. So no more committees. So they kind of made up that month they lost, which is usually a month of committee work. They said, we don't need committees. We're just going to take them straight to the floor. So all of our bills, like I said, we have 6 or 7 of them. They're all now being assigned to the calendar. I think only 1 or 2 have not yet been assigned to the calendar. But the point is, there'll be no committees. That's great. Now the Senate is still going to do it the old way. So they have assigned their bills, all of our House bills that move to the Senate. They have been assigned to the committee. How they're going to work through that, I'm not sure. We have a total of 13 bills, all still alive, 7 on one side, 6 on the other. So I imagine the House, now that they've kind of done a little test drive and see, we can actually get work done with all of this being in the floor. Why do we need committees? So next week, I think they'll start laying out more of guidelines and the rules. But once you're on the floor calendar, the bill is subject to being called up at any time they want. And so so that would be some of the bills that we had for that was the bill that we this was a Dennis Hemler bill, bringing the county employees into the retirement system. Some were left out last time. The lease purchase bill from the county clerks, the margin bill from the county clerks, the PACE bill, the Bush, the bill for drug diversion, the PACE bill. So those are the ones that are probably going to be heard and voted on for sure.
Do you feel like they're going to be successful?
Yeah, all of those bills, and every single one of those Senate bills that are now in the House, either passed 44 to nothing, 45 to nothing, 46 to nothing. Occasionally there was one no vote, but was usually Senator Dunn.
Surprise.
That's okay. I like Nathan. I really like Nathan now because for the House bills that moved to the Senate, they're in Nathan's game. Most of them, the ones that we really want to pass. So, and one of Nathan's actually the co-sponsor of the bill to enforce code enforcement better out in the county. That one is still alive over there.
Yay.
The United Way, I call the United Way bill. That bill is still alive.
You feel like it's gonna?
Yes, because I got Senator Kim David to be the Senate sponsor on that bill. So I knew that if I ran into trouble, I needed a leader to push it. So she'll be doing that one. The sheriff wanted a bill where it said that you got to be able to hire private security to guard inmates when they're in a hospital instead of sticking deputies over there. That's alive. That's actually a Nathan Don bill. So that will probably move forward. We've got the ones that Kathy Burrows wanted to help us with our continuing ed, give you more flexibility in terms of where you can go to get continuing ed, in-state, out-of-state, tech schools, national organizations. Right now it has to be, of course, through both higher ed. So this, like I said, I got this morning at 6 o'clock. So I think next week they'll start putting the rules together, and the House is going to start voting, and the Senate's going to start committee work. And legally they have at least till the last Friday in May. And so I think what they've been doing kind of during this quiet time is they've been doing the budget work that they usually do in May. Well, they did that now. And so they've gotten a lot of the budget work out of the way. So now they'll flip to the policy bills. There's 1,000 policy bills. And we have 13 of them. So we'll know, by the time we have a budget board meeting, I'll know more about if any of our bills are alive. But
That is encouraging.
none of them, yes.
All change today.
Huh?
All change.
Yeah, right.
Yeah, it could change at any time. But we want something to happen because this is the second year of the legislative session. So unless they change the rules, which they can do, it's their rules. If it doesn't pass this year, it starts over next year. That's their rule. They can change it. Or they can come back and have a special session in the fall and say, we're just gonna meet in September and do nothing but policy. They can do that too. I don't think they want to do that, so that's probably why they're trying to modify this and say, we'll skip committees, we'll allow proxy voting. We don't really have anything that controversial. We don't, so we'll see. And your bill is on the Senate floor. Your bill?
Yes.
Yes, it's on the Senate floor. To be called up, yet to be voted on. It's passed everything. Got one stop left. The Senate floor. So we're better than a lot of counties.
Thank you for your work.
We're better than a lot. I'm sorry.
Let's skip around the agenda. Let's do county bidding operations first real quickly.
What a mess this vending thing is. I thought it was just a simple problem that we found an employee stuck a vending machine in the annex bill. So we'll write a bill and get into the vending business. Oh no. We've got vending machines all over county buildings and no agreements with anybody. No. The agreement with the state expired last year. For some reason we didn't renew it. If you see a machine around here that's got a tax commission sticker on it, that's a private vendor. Because the blind people don't pay taxes. So they don't need that sticker. So every machine has one or the other, OTC or DRS. Some of them, so you look at all the gumball machines, they have an Oklahoma Tax Commission sticker. We have no agreements with anybody to put that machine in there. I don't know who owns that machine without tracking down the Oklahoma Tax Commission code permit number.
You stuck them in here?
Well, do we get revenue off those, any revenue sharing to trace them back or anything, or is that something?
I don't know who would be paying.
Why, I understand.
I don't know. I'm still digging into that. We've got, like upstairs on Don's floor, one machine on that hall. There's a clear, there's a clear DRS sticker.
So, I mean, the easy way is just to building out some of all those machines down into a building, and when they start asking about it.
Well, and like, do we have any agreements for the ATMs? When I asked Whitney and Georgia, I said, pull me all vending agreements. There's none. None. With anybody.
I can explain the ATM thing to you,
Okay.
but as far as like the gumball machines and stuff go, I don't know if anyone else has seen this over the years, but the ones that are down in the basement, the folks that run the snack bar are the ones that are filling those. I've seen them fill them dozens of times. So the fact that they have an OTC sticker on them doesn't necessarily mean that those folks don't own them. I don't know why, but I mean, they're the ones that are
Okay.
operating them now.
So you'll either have one of these, or you'll have one of these.
Right,
Let's see those.
You don't have both.
right.
Tax commission, blind guy. Okay, and so, Kathy had our safety guy, David Hayes, did an inventory, but they didn't do every building. So for instance, all the machines in the Faulkner building are owned by a company called Imperial. We don't have any agreement with Imperial.
They're off a copy provider also, so is there are they providing copy service?
They may be, when I asked Whitney, I said, just pull me
I'm
all
just saying, I
three.
mean, that's again, it may not be in a vacuum, it may be an extension of another type of agreement like the coffee agreement.
Well, I didn't ask her about coffee, I just asked her about vending, all vending. If somebody's serving food in one of our buildings under a contract, can I see it? She said, we don't have it. I said, okay. And somehow they got in here, and they may be your point, it may be part of the guy here. So anyway, it just got to be a bigger problem. So I'm not sure legislation is the answer, so I pulled it back. The other biggest problem you have is that you don't have anybody responsible for them. Like if you wanted to ask, you go to mapping, you go to building up, who's in charge of, who is in charge? I don't know.
Someone that the commission would just have to appoint, either a department or
Somebody eventually have to over kind of see it.
Right.
What person you need procurement.
I think so. Yeah.
Under the current law, the only place that a private vendor can have a machine is parks and the jail commissary. So those can be private. And the contract we had with DRS, that's what it said. And when I met them at the Capitol, they said, how come you didn't renew the contract last summer? I said, we didn't? And they go, no, it expired the end of June. I said, would you send it to me and send me the list of where you think you should have machines? And they did. and it's here, and it's the jail. But there's 6 machines over at the juvenile bureau. They said, whose are those? I have no idea. And Linda Johnson's got some, and Gwen's got some. I mean, they're in good places. I just don't know how they got there.
Well, I think in some of those instances, they ask a specific vendor to come in and do it for them because they have a need. So I think you'll find from the department heads that those are things that they individually worked out.
Well, and we can keep them there. I mean, now the problem we have with DRS is that, as you know, the law says that they're the priority enterprise. So
Where they offer.
If Michael were a blind vendor, I'd say, do you like all of our buildings? He said, no, we'll just take the jail and courthouse. Then we're free to do whatever we want with the rest.
But if they say yes,
They say yes,
we pull the others and where the others get pulled and
unless we go back and do legislation and exempt it. Right, you're right. So parks are fine.
well, to me, I mean, the first step is one commissioner needs to probably appoint a person or group to say, you are now in charge. Second step is then either put a notice on all the machines saying, come talk to that person, or this machine's getting ready to be put in storage. Probably clean that and turn it over to someone else to get it. Yeah.
And I've asked DRS to send me another agreement. I mean, no one had approved of them last year. It's been the same.
It's just,
Every year. It's just over the cracks. We just didn't get one done or something.
I would mention 2 things. Number one, before the last turnover in our snack bar operator, so the one before currently, building ops used to require them to come to the BOCC office and get permission from someone, whether it was a commissioner, a chief deputy, or whatever. I know that I brokered a couple of those deals a couple times for machine placement. So like, how much of our hallway are we willing to give up for the machine? If they were wanting to do something different and new or whatever. Part of that was the ATM machine that now sits over here in the escalator building of this building. So we have 2 ATMs on the first floor. Don't you have one on the second floor as well?
Not my knowledge. I think it's just the 2.
Okay, so there's one that's over in the courthouse building that is like over by the DA's supervision and bogus check. And that ATM machine is actually owned by the credit union, the municipal employees credit union.
Okay.
And so any of our employees that have accounts there can withdraw money for free if they're withdrawing money from that account. The other ATM was requested by the former snack bar operator. And so they had an agreement, and we agreed at that time back in 2014 or something, I think, to allow them to put the ATM machine out in the hallway where it's placed now. At one point, it was placed inside the snack bar, and that one is operated by ATM One, which is actually a company my office has a contract with to take credit card payments. So the one thing that I've been talking about is, and I've talked to Maggie about it before, and we need to get it squared away, is to probably amend our contract to include that ATM. It's actually generating fees that are building up with no place to go. So it would be a revenue source for the county if we were to get that contract in place. So anyway, just that's what I know about any of this.
this sounds like a good project that the legislature goes on.
Yes.
Yeah.
I don't have time to do that right now.
Okay, COVID-19.
Okay, I want you to follow this packet along. And I scanned it and I'll send it to all the division directors, but I've just been working on this a week.
Do you have any extras of that right here?
Oh, right here. So let me just kind of walk, because it's happening, believe it or not, the government is actually working really fast because they have to. So I want to kind of walk you through what this does for us and applies to us, so you have an idea that it's going to happen really, we're going to be positioned really quickly. So if you look, I put little numbers at the bottom of the page. So if you look at the bottom of page 1, I think you know $150 billion was appropriated for the states, tribes, and local government. Of that 139 billion is for the states and direct payments to eligible units of local government. You're going to hear this phrase time and again, and this is key. It's also a point of heartburn for some people, not us, but for some people. So they divided that up by the formula of what percentage of your state's population, what percentage is that of the national population. That's how they decided how much you get as a state. And then the state's allocation, in theory, is supposed to be divided by, so how much of your county population is of the state? Just for your information, we're 16.4%. 16.4% of the people that live in the state of Oklahoma live in Tulsa County. If you're a county of 500, or a local jurisdiction of 500,000 people or more, you will get a direct allocation from the federal government. If you're under that, then you're going to have to get your money from the part the state gets. You don't get a direct allocation. So you're like a sub-grantee to the state. And as you'll see here, what I'm going to tell you is in Oklahoma, there's only 2 counties over 500,000 and only 1 city over 500,000. And at the most, those 3 may get a direct, and I mean a direct, they're going to wire it to us. And everybody else stands in line at the capital. So every city, except Oklahoma City, and I'll explain to you in a minute why there's a problem there with Oklahoma City. But the city of Tulsa is not part of this package. They're part of a different package because this is your money. This will be Tulsa County money. The use of the funds, as you'll see at the bottom, is pretty broad, and they're giving you a lot of discretion. It has to occur due to the public health emergency. So whether that, and they are determining, as you'll see here at the bottom, the emergency started March 1st. They expect that it should go through December 30th. So part of these funds will be used for the reimbursement of March and April. And part of these funds is to plan ahead for the rest of this year to do whatever you think you have to do to contain it, control it, prevent it, mitigate it, and anything in that regard.
Before we flip the page, I think the use of funds is anything above budget is caused by this, or anything you could not have foreseen to put in the budget.
That's exactly right. I'm sorry, yeah, that's point number 2. Budget costs are not accounted for in your recent budget. You weren't planning on all this overtime, you weren't planning on all these supplies, everything and anything that we're doing, or things we're going to do. It just wasn't your budget.
So you're going to have, we asked the division directors, you're going to have one person in the area to talk to about capturing expenses. They've given all the bookkeepers names for those parts. You have some meeting with them, bookkeepers somehow.
Yes, and yesterday I sent an email to all the division directors and then told them, watch this today. So you'll hear what I have to say, and then they're going to get it back, just like this. And we are going to have a meeting.
And one thing to also note is that BOCC has sent out to all the bookkeepers a project codes for any costs. They can be put into our accounting system. So those can be tracked instantly as long as they do that. I'm going to follow up with another email to all the bookkeepers and division directors in line with what Terry's saying to make sure that we use that code, project code, because literally, I mean, in my office's example, we bought probably 10 laptops that we've used for remote working. That wasn't necessarily in our plan for the year, but we will track that, and that will be one of our submissions that we throw in. So anything on that project code will give us. We just want to reinvent a wheel when we're tracking costs. So
you providing directions to the bookkeepers about things they need to keep track of.
Yes, and you'll see in this packet that I've worked with IT to prepare a form, an online form, in real time, just capture it. These are the things the feds want. On page 2, all that's required at some point is a certification. A certification is a letter. It's a letter that would come from the chairman of the county commission, just verifying the information that the expenses we've had and the expenses we expect to have are clearly in line with those purposes. It's like 1 or 2 paragraphs. That's all the certification letter is. Payment. The Treasury shall pay within 30 days of an act. The bill was passed and signed by the governor or president Friday, March 27th. So last night, and I'm not kidding, I get these all night. So last night, I get this from Senator Inhoff's office, and I have to say that the relationships that we've had with their office and Ern's office is what's really keeping us ahead of the curve. Because Treasury is now trying to weed through and sort through that 239-page bill to figure out what does it mean and how do we do it. We're Treasury. We're not in the grant business, but they're having to figure out how to make that work. Last night, Dan Hildebrand, the legislative director for Jim Inhofe, said, Treasury expects to dispense the funds to the states on April 24th. They are also working to issue the guidance on how to use those funds April 20th. Treasury is currently working to roll out an online portal for local units of government to use to apply for their funds. So there'll be a portal of some kind. We don't have to go through the state and Zach, the deputy chief of staff, or Mike Mazie, who I've talked with them. No, it'll be a portal. Send me the money. And they will say
20 is when they set up what qualifies.
yes, we'll call it guide, some kind of guidance. And I'm going to show you a list of some of the things I've already picked up from in the packet that looks like it's going to qualify. You won't be surprised. It's exactly what you would think.
So some of the small businesses that apply, they almost run out of money. You have to come back for. We need to get ours in there as quick as we can so that run out this money or.
No, ours is locked in. This is locked in, and I will show you here later. They're working. They started Monday. They're working on package number 4.
So I'd be still be quiet.
And that's more of your paycheck protection money and a few other things. Now, at the bottom of page 2, I want you to see this at the bottom of page 2. So here's a point that NACO is trying to get Congress to clarify. The local jurisdiction over 500,000 gets 45% of what the state gives. Okay? The issue is, does the state get to take their piece off first, and then it's 45% of net, or is it 45% right off the top? Our piece, our 16.4% population piece. Now, what difference does that make to us? Well, you're going to see, the difference is about $140 million. That's the difference between one interpretation and another. Okay? The states want to keep more of it because the states say that besides what you're doing on the ground, we also kind of overlay you because we provide services to the county too, from the state. And we should be compensated for that. So that's their argument. So it's the state health department, and they're in Tulsa County, and they're working with the county health department, and the state would say, we should give some money for that as well. We shouldn't get all of it. That's kind of what they're trying to sort out is what's the formula for what the county receives. Okay, if you look at page 3. So this has been confirmed time and time again. The Oklahoma allocation is going to be $1.5 billion. That will be the state with this Oklahoma gets. The state believes it's entitled to 1.2 billion, billion, and that we would receive just under $114 million. $114 million to Tulsa County. And remember, all the cities in the county, they're going to be able to go get their money too. So at the end of the day, if someone were to say collectively how much money comes into the geography of Tulsa County, we don't know yet. The mayor will get some, the mayor from Bixby will get some, the mayor Paul, they'll all get their own through the state. This is just county money. So this is money that, whether it's for county-related expenses, not city-related expenses. Now, if we're partnered with somebody, like let's say TEMA or the health department, the money can join up. And we can say, we'll give this much to Joe, we'll give this much to Bruce, and GT can do the same out of his piece. But
So on that note, so would we be able to take funds out of that if we, probably not, but if we realize that where we're staging TEMA is wholly inadequate for crisis?
well, as you're going to see,
Facility.
if you're going to see what I've pulled from different places, there's kind of a criteria for how do you qualify as a project? Here's the questions that need to be answered. Because Joe's already asked me about construction, and I don't know what I said. I don't know yet. There's no guidance document. But if you read the bill and you read the literature, you can kind of get the flavor of where they're going. And beyond just masks and, equip things of that nature, tents, shelters, overtime, air regeneration systems in buildings, regenerate the whole air system in here, $2 or $3 million, whatever, for that building. Anything that's health related that you said, we're doing that, and this is how we believe it's related to the public health crisis, and to prevent it from reoccurring or to mitigate it.
Oh, that's good.
So that's what they're working on. It's
A determination of, they're working on,
some guidance. I don't think,
and the treasurer.
Treasury. I don't think that they're going to be, if where they go in the future is any indication where they've been so far, they're not going to get in the weeds. They don't want to get in the weeds. They're going to trust you with that 3 criteria. You make the case that this was related to the public health crisis, and tell us how.
Until they're like FEMA, and they said, oh, yes, that was approved until it's not approved.
Right.
So that's the fear, is of actually needing that guidance.
And once we get the money, we have until December 30th to either spend it or encumber it, and what we don't spend or encumber, we have to get back. Now that's just package, this is just this package. There's another package coming.
Terry, so on that note, I mean, Miyuki and I have had discussions about this whole notion of getting money. So, I mean, we've talked about 2 different things. A, the federal government ships us a check or wire transfers us $113 million. Or B, we apply via a portal and we get paid for those projects as we apply. So do you know?
No, they're not gonna, they don't want to dribble it. They're gonna send all the money. They're gonna say, this is your allocation, and all we're asking you is that you have a certification at the end, or maybe periodic, to show us what you spent it on, so we don't have to claw it back. So,
Before you leave page 3, this is the worst case scenario for Phelps County, right? Because
that's what
this assumes the state takes theirs first. We take 45% of what's left.
that's right. And let me just say that, so what Congress, I don't know if you're familiar with the Tax Foundation, but the Tax Foundation is a nonpartisan tax policy think tank that has been advising presidents and Congress since 1937. And so when they have a bill like this, they shove it to them and say, do all this calculation. And both Senator Inhofe's office and Representative Hearn's office got these numbers from the Tax Foundation. So you're correct, Commissioner. Depending on how NACO works with Treasury, it won't be less. It could be more than that. The preparation I'm going to walk through here with you over the next few pages. If you turn to page 5, just from talking to division directors, I'm not saying this is a comprehensive list, but I know from talking to all of them, they've all had some or will have some expenses related to this in some form or fashion. On page 6,
Where you leave it, Expo Square, as Expo Square, for example, said you're calling you out there.
yes,
Okay.
you'll see I've got on the page here. So if I've left anybody off of here, please tell me. But I've talked to all of them, and remember, this is the CARE Act. So it's called Coronavirus Relief Act. So we're not dicking around with FEMA. Okay, if you want FEMA, FEMA can come later. And some of those smaller communities that don't get as much from the state, they may partner it up with FEMA. But there's no match here, and they've actually cut so much red tape. And I've had to kind of walk that through with Joe and Reggie, because they're used to FEMA. That's all we're ever used to with disasters is FEMA. This is FEMA on steroids. They're saying, we don't have time to wait around, and you pay, we send bills, and we reimburse, because we know you don't have the money. And your revenue's probably going down anyway because of the impact. So we want to get you the money so you can start spending it, both to protect everybody and to shore up your loss.
So the suburbs will also be able to, they'll get a similar percentage allocation as well?
I think that's, yes, I think it'll work.
Eventually.
Yeah, whatever percentage broken arrow is of the state, I think that's what will happen at the governor's office, a similar proportional division.
They'll have to make their case in the governor's office.
They'll have to make their case. So again, page 6, just things I've read that, and they're obvious, but I'm sure there's more related, eligible, but that's the guidance that I think Senator Inhofe's office was talking about last night. Will be coming out on the 20th, the week of the 20th, more guidance, because that much money you're going to have to choose. Page 7 and 8. Okay, so here's the list of the departments, the directors, and all the bookkeepers. Okay, and I talked to each of them, and we'll do, as the commissioner said, have a sit down. But every one of the purchasing agents or bookkeepers were identified by the director. This is our key person. You talk to them, work through them, and kind of help them catch up on some things. Page 9 and 10, Nan and his team, I said, I need a one-page form. Somebody can go up and simply put in the information that is going to be required for this funds, and then just hit save and save. And then do a summary every month.
And this is that purchase order number, is that what Michael?
If they have a purchase order number, yeah.
You need it.
Well,
What was
this is separate than the thing I was talking about before. So if someone's going to, like when we buy our laptops, within our encumbrance of a purchase order, we're adding a code, a project code to that purchase.
Wouldn't that be helpful to have that on here?
Yeah.
We can do that.
Yeah.
Sometimes I'll have them make
I think the
just a
benefit
draft.
of what Terry is talking about is when we go to make application for the money to come back to us, it'll help to have a narrative to go along with all this. We can't really provide a narrative on a purchase order.
Right.
Or, all we have are the facts, which would be the purchase order and the invoice and all that kind of stuff.
See, that's why I put here this one box purpose, because he's got to know when he signs that certification letter, I want it to be represented to him that this fit a purpose that's approved.
I won't know that till later, but.
That's right. That's right. But there's a backup to it. And yes, is there something we should add to this? I mean, this is, it's on 2 pages, but it's really one screen. And with drop downs, really easy. Those last 3 questions are yes or no, so it fits the criteria. Is it health related? Was it in your budget? Did it happen between March and December? Yes, yes, yes. And then the other information.
So have you seen the form, Dr.
I have not seen, I think it's the packet, so
I will send you a copy.
And to finalize this form, you need to make sure. it's
Absolutely.
For everybody.
Absolutely.
Okay.
So based on what I've been able to read and pick up, if you look on page 11, this is generally the kinds of questions that your division director, or it could be Dr. Dart, or it could be Joe, or it could be Mark Andrus. If you think you have or are going to have an expense that you want at least qualified, these are generally, they're pretty obvious questions, but you have to justify when you have that much money. You've got to be able to justify that it is actually going to help employees or help the citizens. That's a general analysis there. And then the last 3 pages. So there's so much to this that I put this together for myself, that I was getting lost in all the things that had to be done. And so I put together a management structure, kind of a management worksheet for myself, right? So I can make sure that the things in blue I've done, it's not done. I've suggested to Commissioner Peters that it would help me if I had a management team with me. Maybe have Michael or John Fothergill or Mackie or whomever, so that as we work through this management worksheet, if we do these things, we're in good, we're okay. We'll be not in trouble with the feds. And
I just want to thank you and the commissioner for jumping in and setting this up.
I didn't realize it. And now that I figured out about the population thing, we're probably going to be first, because we're the only county. There's 26 jurisdictions in the country where a city is in a county and they both can claim they have more than 500,000. 26. We have one of them, Oklahoma City and Oklahoma County. So NACO is in these several of these letters now going, but this one's to minutia, this is McConnell. They're trying to ask for some guidance. Like, so what do we do in those places? Do they both get 45% or the population piece? Not our problem, but that's going to slow them all down getting their money. Ours is pretty clear, 500,000 or more, and we don't have anybody to compete with in our county. So we don't have to go, we're not a sub-grantee, we're direct. They call it direct.
When is the anticipated funding?
No later than the 25th of this month.
It's on its way.
Yeah. Now, here comes package number 4. And they're already working on that, and I get these letters and ask a comment on this was from the Pelosi last night from NACO. Okay, so now they want the next package to cover lost revenue. They want it to cover the payroll tax credit. They want to forget the 25% match from FEMA, eliminate that, and a whole lot of other. I've got them written down here, kind of some of the main ones. So they're kind of on a roll. They're going to roll this one and just kind of keep it going. So I will. I'll get you guys. You can look at the form. I'll send you one of the packets. I'm going to send all the division directors what you have. I scanned it before I came here, so they can get it. Say, look at the form, provide input to Dan or whoever you guys form. Start getting your, I don't want to say wish list, but start thinking projects and start pulling together what you might need to say, make the case. If I was sitting here in front of you in September of last year and I said, you don't know this, but in February, you're going to be hit with something you've never possibly imagined. What would you do in September to prepare yourself for what's coming in March? What would you say? Most people wouldn't know what to say. Well, now we're in it. And that's why they give you till the end of December, because they said, we don't think it's going to be gone or could still be around. So plan long term. And we'll know by this time next month, we'll know the exact amount of money, exactly how the percentage is going to be broken down. And we'll be starting to go. Health department is very glad they don't have to go through FEMA. Joe is very glad he doesn't have to go through FEMA. One other thing I will tell you is there's probably 30 side pots of money for specific things. And one of those is they did put a bunch of money over to the Department of Justice just for law enforcement in jail. And so I found a Bureau of Justice Administration grant program for the burn grant, and they've already told you how much you're getting, but you got to ask for it. And so the sheriff gets $73,414. You just got to apply for the grant by the
It's
end of
not
May.
too much, but it will help.
It'll help. Well, and as you probably remember, last month you signed an agreement amending the contract with Turnkey because their cost has now gone up $18,000 per month.
Yeah.
For assistant, nurse assistant, medical assistants, other things. So they have a lot of cleaning, a lot of disinfecting. So they're going to apply for the grant, I believe. You'll see that on a May agenda. So that doesn't have to come out of your.
But we'll have some funding available to them because they're.
But that was just an easy supplement to get.
They have done a remarkable job.
And that was easy, and it was right, and they already designated it for you. I mean, nobody, it's yours, so you have to do the grant to get it. So,
In terms of managing the task force to look over this as we move forward, how do you micro first? That's the most critical stuff before, right? Make sure we capture everything, and you guys go decide who else you need to have frequent contact with.
okay. Like I say, it's happening every day, something every day. Is shut down every.
So do you think, this is probably coming on the April 20th thing, but with regard to guidance as it relates to longer term projects, so when you're talking about air handling or, emergency facilities as it relates to FEMA or software projects like we've been talking about, switching over our software that would ultimately allow our people to work remotely a whole lot easier than what we have today, and track costs and track time and all that stuff. Have you heard anything about like a time horizon? Like, I realize that as of today, we've got till the end of December to get these projects planned, but like our software project we're working on, we're planning on starting that project in July. Start the implementation. It's going to take 18 months for us to get fully live on it. So,
okay. I see what you're saying.
is there a time horizon? And certainly if there are going to be any construction projects, those are 18, 24-month usual projects.
Not yet. There hasn't been a guidance that says you must have it done by December 30th. Even if you're paying for it in January and February, it's got to be done. I haven't seen that yet. What's great is I'm working with the executive staff at NACO, and so they've got a portal that says, send us a question. You won't be the only one that has it. We'll shoot it to Washington. We're working with the Treasury people, and we'll get you the answer. So I'm working with Dorita, her name's Dorita, at NACO, and I sent it to her, and she sent it on. She's the one that sends us the NACO letters that we're sending to Washington, asking for feedback, saying, please tell your congressman, to vote to approve revenue funding. And the last thing I wanted to mention to you that was different in this is that I know that come July, August, or September, your sales tax checks are going to take a hit.
Yeah.
And you got 4 funds. And I wanted to make sure that the CJA and PODS, Family Justice Center, and Vision, where are we? Because there was a provision that talked about covering municipal bonds. I don't know that we qualify. You got to demonstrate a loss. So working through Terry Pulley, she's the vice president at BOCC Financial. She's the trustee for our money. So, we've got a monthly payment due in June, and we've got 3 due in September. I thought that's bad. It's right when those checks are probably going to be smaller. So I wanted to know, how much do we have on hand? A balance. Do we have a balance on hand? Because she provided me great numbers on historically what we've been getting each month on those 4 sales tax, and we won't get those. They're going to drop. I mean, unlike a recession where it's kind of, goes downhill gradually, this is more falling off a cliff. It's just going to be gone. So it looks like, according to the bank and what she provided to me, we got some big payments coming in September and June. I think you're going to be okay, even with softer checks. According to the bank, when I asked him, I said, based on what you know, all I want to know is, can we make the September payments? Not knowing, is there enough on hand to make the September payments, depending upon the sales tax checks. And I think because we had some really good times, good sales times, we built up a reserve. That's the last thing you want to do is, you don't want to screw up your credit rating or bond rating, but saying, I can't make that month's payment, can you give me 6 months? No, we don't.
There's some talk that previous bond issues have been insured. You talk to Wyden, see if that's the case.
I've asked them that too. I haven't got an answer about those, but according to what we got together, there was about a $6 million balance in the bank for the jail, $1.6 million for the health pods, $5.6 million for the Family Justice Center, and $3 million for Vision. Those are all, there now. The payments range between $3 million due in September on the Family Justice Center, $700,000 due in September on the jail, $1 million due in June. That's the first one coming, Vision project. So it was just something to be aware of, because I've been on the bad side of that, where we weren't ready.
So
had a recession.
So if currently lost revenue is not eligible, but so is tax revenue going down, consider lost revenue would be eligible for this?
Yes. If they can pass in package 4 lost revenue, again, we'll see.
Right now, our loss of sales tax would fall.
The only reason I was looking at this is that there is a bond provision where they can come in and help assume some of the bond obligation. They don't call that lost revenue. Well, it's only in default, it's a lost revenue. They don't call it. I mean, I get that. It's just a funny way of coming around to it.
It's a bond money to apply for it.
we don't want you to default. So, but we're okay. Projects are okay.
While we're talking about lost revenue as it relates to the fires, I wanted to mention that, we have our budget cycle coming up, and, I've done a little bit of research, with the assessor's office related to our potential for lost revenue next year. So as you all probably know, property taxes are based on values as of January 1. Property taxes for this year are already set, and those will be collected. I mean, like they're collected every year, and there probably won't be any major hits to collection this year unless this just persists throughout the year. But what we need to be concerned about is next year. Most likely residential markets won't get hit too bad here, but commercial markets could get hit significantly. I'm sure several of us have talked to some business owner friends and other folks that we know who are leasing space or they're a tenant of space or whatever. But Assessor Wright and I have had a discussion, and he thinks that there's probably, you could have up to a 20% swing in commercial values. And that would probably be pretty extreme. But if that happens, and most of this is going to be mostly in the retail sector, but certainly hotels, some other commercial businesses that are demand driven based on just expendable dollars from the public.
Do you have a percentage of how much current ad valorem comes from residential versus commercial?
I do. Commercial is about 27%. That's what I asked the assessor to provide us. So
20%, 27%.
27% of our values are based in the commercial space.
So there's 20% of the 27%.
Yes, which would be a potential of about $3.4 million next year to our general fund. So now, knowing 3.4 of the 65 to $70 million or so we get a year is not a humongous number, but again, you all realize that while other jurisdictions like city governments always say, "Oh man, we wish we had that property tax." Well, our property taxes never go up that much, right? So this year, for this budget year, we're looking at a 2% increase over last year. Well, that completely gets wiped out for next year, most likely, and then some. So we need to be really careful. And thankfully, we're going to have safeguards in place with this federal assistance to help us with some things. But, just want to throw that out. $3.4 million could be our loss in revenue for next year.
Also, like I talked to Richard Johnson in the treasurer's office about the earned income on the bank. Because we earned the interest. And she, originally I was given 1.1, 1.2 million. So I budgeted a little higher because this year's collection was pretty high, 1.5, 1.6. But I got an email back from her this morning or yesterday afternoon. She said just budget like 150,000 instead of 1.2. So just to, I was kind of shocked. It was quite as wrong. So just
90%, yeah. We could have done that report.
what's that?
We could have done without that report.
I had a long conversation with two guys that own a lot of commercial property, in particular with a lot of the restaurants in their portfolios.
Yeah.
And they've already given them 90 days, no rent. And then they got to figure out, neither one of them are optimistic about what happens at the end of this. So how do they dig out?
If you can keep track, I mean, I don't know ultimately what lost revenue is going to cover. Okay, but anything that you call lost revenue. Now, one thing I did ask Dennis and Steve Blue is I said, I understand that you waive penalty and interest for people that paid the property tax late. Do you want me to try to recover that, as an expense? And apparently it either wasn't that much or it's quite a complicated set of gyrations that they said, it's not worth doing, so I said, okay. But that's the kind of thing you have to look for, is the things that aren't obvious, it might be under a little stone, but we still lost. And we wouldn't have, but for this. So that information's good.
Very much together, this on, and we have, last I heard, BOCC appointment soon. Rarely will know mid-month whether he's gonna be reappointed, if he's reappointed, and you'll reappoint him.
Yes, that's, that.
All this we have.
Move to adjourn.
Second. All in favor, say aye.
Aye.
Okay, I think we're good.
Back to